is Rachel Burnett. I'm 25. I live in Pittsburgh, Pennsylvania, and I am one of the 3.1 million Americans who lives with IBD. And I've been living with Crohn's disease for about 15 years. Through multiple major surgeries and crippling symptoms, I can confidently tell you that one of the worst parts about living with this disease is the fear that I face every single day around the rising cost of my medication. And at 25, as I age out of my parents' insurance, I've really started to realize just how much this illness actually costs me beyond the prescription drug costs. And, my fear has gone from complications around, having issues with this illness to now just how this will affect my future. My primary medication that I received, and I've been on this medication for about 10 years. It's a very common biologic for Crohn's and colitis patients. To date, this one medication that I've been on has totaled over $1.5 million. It's about $20,000 a treatment, and I receive treatments about every 7 weeks. So I live in fear and stress of wondering just, how I'll be able to afford my health and to stay healthy. Because if you're not healthy, you can't work. And if you can't work, you don't have access to the level of health insurance that you need. And the stress of dealing with this ultimately makes me sicker and ultimately, impacts my illness. So it's just a constant cycle. And, at 25, while people my age are buying homes, they're getting married, they're having babies, I have to make every decision, keeping in mind the burden of the financial costs that are going to come from having this illness and just the high drug costs that I need to keep me healthy. And without protection for drug prices, patients like me are often forced to alter our treatments, and we have to compromise what little health we have left and what ground we've made up. I know people who have had to, withgo drugs and have ended up, in worse spots, having other surgeries, having other complications, all because you can't afford the medication that you need to keep you going. And I'm frustrated. I didn't ask for this kind of life. I would gladly give it up. And frankly, I wish I could go just one day without having to continuously advocate for myself to other people, to my doctors and to legislators who quite literally hold my future in their hands. It's completely up to them whether they want to listen to me and they want to hear me or not. An accessible and affordable medication is not out of reach. It's not. It is absolutely within our reach, and it's within our right. And the Prescription Drug Affordability Board makes this a possibility. Other patients telling their stories makes this a possibility. Pennsylvania residents, there are many of us, should not have to live in fear of these prescription costs. We are a major health system with multiple health systems. And the drugs that we're being prescribed, they don't work if we can't afford them. And right now, we cannot afford them.